What is selective neurolysis? My name is Amit Kochar, and I'm director of the Facial Nerve Disorders program at the Pacific Neuroscience Institute in Santa Monica, California. Today I'll be discussing a procedure called selective neurolysis. If you're undergoing this procedure, you likely have severe synkinesis, or abnormal facial movement, as a result of an injury to the facial nerve, most likely from Bell's palsy or Ramsay-Hunt syndrome, or from a complete paralysis following a tumor removal, in which your facial nerve did not recover completely and has led to unwanted movement on the affected side of your face. This may include squinting of your eye when you smile, or when you blink, your corner of your mouth may pull up unwantedly, or you could have severe tightness in the middle of your face or in your neck. The procedure itself has been designed so that we perform exploratory surgery on the facial nerve, where it exits behind the ear and we trace it anteriorly. We find all of the branches of the nerve that we can, and we stimulate them intraoperatively while you're asleep to assess if they're functioning properly. The ones that are functioning improperly are then cut and removed. This is done so that we can allow your face to function better, and so that you may or may not need Botox in the future. However, Botox treatments for the eye are typically required, just so you know, because the nerves that we're cutting are not affecting the eye during that procedure. The surgery can be done as outpatient, or you may want to spend one night in the hospital for observation. Following surgery, you'll be seen 1 week afterwards to have any drains or staples or sutures removed, and then you'll be seen 1 month afterwards. Patients will typically notice significant improvement in a few weeks and reduced pressure or tightness from the face. In some cases, we can also perform additional surgeries, such as brow lifts, eyelid reconstruction, or contralateral facelifts as well. So please ask your medical assistant or your doctor about that if you're interested in that. Patients will also be followed for several months after surgery, because in rare cases, they may require revisions if some of the activity or the unwanted activity returns. It's unknown how often this occurs, but the literature reports it in about 5% of patients. So I like to keep a close eye on someone to make sure that we're addressing it if it becomes an issue. If patients elect not to have surgery, they can be treated with continued Botox. However, if that is something that they wish, we can discuss it and see if they're a candidate